So it looks like we're live, he said, hopefully. And I should like to welcome these gentlemen to the screen. We have Carl, who is down on the coast there, uh, Andrew, who's out there in Lisbon, and Matty, who is just up the road from me in Palmball. So as I said to the gentleman off air, but just to anybody that happens to be listening, there might be some lonely soul out there who's actually listening to this. Tonight we have just a little bit of experiment, and my topic is information wars. Now, there are so much news reports, independent social media comments, etc., with so much conflicting story, advice, whatever, that one can often get sort of disorientated and not really know who to believe, what to believe. So tonight we're going to do a little presentation which I'll put together, which is purposely made really to be emotive and bring about some sort of reaction from people. But it's a transition of information from one side and then another, which kind of conflicts, and evaluating one type of information against the other. So what I will do is spend just probably about 10 minutes going through this hard-worked little presentation I've done, and then come back to you guys, or whoever wants to come on. I'll put the link on if they want to. We do have just a spare couple of places, and take it from there. So, gentlemen, are you all right with that? Yeah, so if you can all mute your microphones, I'll go to single screen and I'll take it from there. So wish me luck, because anything could go wrong here. Right, hopefully I can get this all working. So forgive me, everybody, because I'm going to have to keep moving around because I've got several screens open to do this. So just give me a bit of latitude. Right. The main topic of tonight's discussion is the contentious subject of the COVID pandemic. And as I said, we're all left in limbo, and you want to get a clear information on things. And with all the conflicting information, the information war that goes on, it can get people very confused and very emotive and worked up, and sometimes really not logical at all. So what I'm going to do here is I'll work through a little bit of the presentation I've done, giving the one side of the argument and giving the other side of the argument. So basically we have the alternative viewpoints in the COVID outbreak and treatments, etc., and the mainstream. But first of all, according to regulations, I must do a disclaimer, which makes me have to read, which I really don't like at all when I'm on screen, but here we go. The information and news articles within this broadcast were collected from open source media. They are in no way definitive, instructive in their purpose. The views and conclusions of topics discussed in this broadcast are for the purpose of free and open debate, and such the views and interpretation is down to the individual. Got that done. Right. So during the pandemic, we're bombarded with the conflicting views and information. So what we're going to do, we're going to look at Group A, the alternative group, and then Group X, the expert group. So that they represent the medical mainstream and the experts, the people we trust. What I've tried to do is attempted to balance the conversation and use as many sort of information sources that are the same to give an equal sort of balance. It's not always been possible, but it's been quite difficult to do. So let's bring onto the screen, and I'm going to have to do a bit of clicking here, the first of the Group A. Now, this guy here is Pierre Corey, an American critical care physician who gained attention during the COVID-19 pandemic for advocating the widespread off-label use of certain drugs and treatments for COVID-19. He is also president of the COVID Frontline Critical Care Alliance, and Corey testified twice to the US Senate regarding COVID-19 during his testimony. He erroneously claimed that the anti-parasitic medication ivermectin, which we will talk about later, was a wonder drug with miraculous effect. So he was one of the founders of the COVID Critical Care Alliance, which is Group A, basically, we're talking about here. The other guy in the equation was this guy, Paul Marek. He's a former medical professor of medicine. He's worked at the Eastern Virginia Medical School as a division critical care medicine, and also at the Centara General Hospital. So we've got a lot of kind of medical guys here. They're not just everyday bod. He's also the co-founder of the Critical Care Alliance. He fell foul of the same trap where he advocated ivermectin to treat COVID-19, which was against all leading healthcare advice, which we know. Then we bring into the fold probably one of the poster boy for them, really, Dr. John Campbell, probably one of the most visually recognised faces on the scene. But John Campbell, an English YouTuber, done a lot of videos on the COVID pandemic, but he has also been accused, and I'm going to underline that, accused, because they've all been accused of misinformation. Also, he advocated the use of ivermectin as a COVID-19 treatment. And although he tries to present things in a certain way, sometimes by his own admission, he has actually got it wrong, which is commendable, really, I suppose. Now, just let me just resize this image for some reason. There we go. So those are the three main contenders in the fold. They've all been criticised for having certain views against the mainstream, and criticised does not necessarily mean prosecuted or found guilty of anything. And also, you've got to apply this to both sides, and I've got to be fair. Nobody on either side of this has gone to court or been charged, to my knowledge, of any criminal act or wrongdoing. So I'd like to put that one out there first. Just going to quick look at my notes, please, just so I can catch up. Yeah, the Corey and Marek actually resigned from their positions because they felt they were being held back from their treatments in the pandemic, and they left to form the Critical Alliance. Some would say maybe they've done this for a financial incentive. Some might say they've done it for moral reasons or whatever. And do they make money? They very probably do, because they work for a non-profit organisation. But that doesn't mean to say they don't make money. Of course they do. And as far as our man Dr. John, he's got a YouTube channel, and he makes money from it. So from the initial opening of this, it doesn't really look good for these guys. They've been squared off by the media and sort of run out of town, and criticised in many different ways for their views and not conforming to the standards. So I think it's only fair also at this moment, I'll come back to me, is that I give my snapshot of me at this time. Now, very early on in the pandemic, we were all scared. We were all in the land of no-no. And being in a high-risk category myself, I went full-on military decontamination procedure. Everything that came into the house was disinfected. All the footwear was disinfected. Clothing was sprayed. Probably sounds really over the top now, but that's the only guideline I really got to go from. And just to give balance, I've had a Moderna and a Pfizer vaccine, and I did have mild side effects. But we will now bring into the fold the Group X, the other guys, the people who criticise, who have made charges against Group A. Now, for me, with the weight that these people have got and the organisations they work for, the funding, we should be super critical, because they've had the full roll of the ball as far as. So I'm going to give them the maximum attention as I can, and that's what I did in this little study. So let's look at the World Health Organization, shall we? Now, what were they saying early on in the pandemic? And I'm going to blow this up a bit. So, right, on the 30th of March 2020, the World Health Organization reiterates the recommendation of not wearing face masks unless they are sick with COVID, or caring for someone who does. Now let's just think about the advice that we're being given at that time. The advice that I remember being given is get your vaccination to keep you safe from getting it. Get your vaccination to stop you spreading it. And that was what was going around. The WHO, World Health Organization, then put this little post up. And this was in June of 2020. They now said the WHO recommend mask wearing for members of the public, a change from their previous recommendations on the basis of increased evidence. The organisation still had reservations and cautioned that mask use by the general public was still not yet supported by scientific evidence. So we're kind of in that place when we do, but we don't, which is not really much of a place to be if you really want the answers, do you? So let's have a look at the CDC, Centre for Disease Control. And once again, I'm going to have to blow it up so I can read the slide. Now, bear in mind, these are the experts. These are the people we are supposed to be trusting and should give us the best possible guidance, etc. So it took really the CDC almost probably a year, maybe a bit more, to come up with a recommendation that everyone should be wearing a mask in indoor public settings, regardless of vaccination status. That's well, for me, that's a bit slow to be responding, regardless of whether you believe that masks work or do not. So we will come back for another quote from them now, CDC 2. This is what actually they said. Now, remember, we were told to get vaccinated to protect us from getting the virus and told to have the vaccine to stop us spreading it. So the director, Rochelle Lewinsky, actually said in a press briefing that vaccinated and unvaccinated people could have similarly high viral loads when infected with the Delta variant, but did not say that vaccinated people had a higher viral load or were super spreaders. She also stated that the vaccine continues to prevent severe illness and hospital and death. Now, you could argue, and a lot of people do, that is true. It is, people not so many people dying from it. But you could also argue that the actual virus has weakened and is not so lethal. So two ways of looking at it. But this really starts the ball rolling for me. A later statement says this: for 75 years, the CDC and public health have been preparing for COVID-19, and our big moment, our performance did not reliably meet expectations. Same author again, Dr. Walensky, and for me, she's kind of admitting there they just didn't hit the mark. They failed the public, which is kind of a bit of a stunning admission, really. Now then, we come to the next person, and probably the most recognizable, Dr. Fauci, deplored by some, loved by others, and just let me go and move my notes across. Right, yeah. Okay, sorry, I'm going to have to blow that up again for me to read it. So, who is Anthony Fauci? He's an American immunologist, works for the National Institute of Health in the United States, the National Institute of Allergy and Infectious Diseases, and the National Institutes of Health. He became well known in 2020 during the COVID-19 pandemic in the United States for his information about preventing the spread of disease. He has been called the nation's leading expert on infectious diseases. I don't need to read all of that, but you get the general message of what I'm saying. So what did Mr. Fauci say early on in the pandemic? His advice, first early in the deal, was Fauci was telling people, and this is a direct quote, on the 29th of February that there was nothing to worry about and it posed no threat to the US public at large. And then, sometime later, he came up with this. Dr. Fauci, who was leading the US responses to coronavirus, added, "No one is going to deny that logically earlier mitigation could have saved lives." Is that an admission that he got it wrong? you take the which way you will. And then the story deepens because the famous Congress address, and this is Senator Rand when Fauci addressed Congress, now pretty famous in history. This is what Senator Rand said. Juicing up superviruses is not new. Scientists in the US have long known how to mutate animal viruses to infect humans. For years, Dr. Ralph Baric. Now, I want you to remember Dr. Ralph, because he will pop up in the story later on. A virologist in the US has been collaborating with Dr. Shi Zhengli of the Wuhan Virology Institute, sharing his discoveries about how to create supervirus. This gain-of-function research has been funded by the NIH. Dr. Fauci, do you still support funding of the NIH funding in the Wuhan lab? And the now famous response from Dr. Fauci was, Senator Paul, with all due respect, you are entirely and completely incorrect that the NIH has not ever and does not now fund gain-of-function research in the Wuhan laboratory. And then the story thickens because Eco Health Alliance, who was getting funding from the NIH, a little bit about them. Eco Health Alliance is a US-based non-governmental organization with a stated mission of protecting people, animals, and the environment from emerging infectious diseases, which sounds a very noble cause. But however, in 2022, the NIH terminated the Eco Health Alliance grant, stating that Eco Health Alliance had not been able to hand over lab notebooks and other records from its Wuhan partner to relate to controversial experiments involving modified bat viruses, despite multiple requests. Now, let's go just shift that around. I'm going to ask you to just read this with me, right? And this is in direct correlation to that. Eco Health Alliance president, here's the other guy you've got to remember, Peter Daszak, who worked closely with the Wuhan Institute of Virology, helped people steer media and scientific community away from questions about whether COVID-19 could have originated in the lab. Emails released under the North Carolina Public Records Act show emails between Daszak, I can never say this, guys, Daszak and the University of North Carolina virologist Ralph Baric, another collaborator at the laboratory at the pandemic's epicenter. So, a lot going on there that kind of needs answering. So, was there anybody else? Who we should know about involved in all this with Eco Health Alliance and such? And just by sheer accident, I came across this article, which says that the Defense Department doled out millions of dollars to some same non-profit that funded federal grant money to the Wuhan Institute of Virology. God, this is a tongue twister. For bat coronaviruses research, with most of the Pentagon money going towards murky research on countering biological weapons. The New York City-based Eco Health Alliance has already come under scrutiny for redirecting funds from the National Institutes of Health to the Chinese lab, from where many believe COVID-19 is leaked to set off the worst pandemic in a century. But federal spending data shows that Eco Health has a long and profitable relationship with the Pentagon. The plot thickens, does it not? Now then, our last into the breach. Money. We know that the World Health Organization and the CDC have massive budgets. And how's about Mr. Fauci? Did he get any sort of financial gain from this? Well, it actually seems he wasn't badly paid for it, because Dr. Fauci was the highest paid government employee, $480,000 a year. Dr. Fauci is now retired and looks to be charging rather a lot for his private speaking engagements. So lots and lots to think of there. But we can rely on the WHO team, the World Inspector team that went to the labs in Wuhan, can't we? Well, I did a bit more digging and this popped out at me, which took my breath away, really. One of the guys I asked you to remember there, Peter Daszak, was a member of the WHO inspection team, and he was also president of the Eco Health Alliance. Now, it says CNN. You can't trust CNN, can you? So I actually double check that. And if we go to the WHO website, there he is. There he is on the World Health Organization inspectors roster. So, recapping on what I'm going to recap on, right? We have, for me, a clear trail of conflict of interest. You have guys who have received funding from the government. We have the Pentagon involved. We have obstruction. We have people involved at various different levels. That is my own opinion, right? That is the way. That was my emotional journey through it. And a couple of times there, you think that cannot be right, can it? Because these are the people we trust. Now, if we weigh up Group A, as we first did, what they did and how they were discredited through their tests being inaccurate or whatever, right? And then we weigh up the people who judged them. Where do you stand? Where do you stand on that? What's your thoughts? So I'm going to bring you guys back in just for any comments that you might have. So switch your microphones back on and let me know what you're thinking, so I can have a drink of tea.
Nice, thorough presentation, Garbo.
So through that little journey, long and complex though it was, did you have any emotive reaction to what I was saying there? Was there a moment where you said, "Oh, hang on a minute, that don't sound right, does it?"
Well, nothing any different to what happened through the whole thing.
So who do you trust? Who do you trust to give you the information?
In this particular
debate? In this particular framework, but it could, be so applicable to so many other different things in the world, whether you're talking about politics or whatever, right? The media sources, you are looking in an emergency for somebody to trust, yeah? Mm-hmm. And good guidance.
But I'm not. That's the thing. I don't. That's the interesting thing is, there are some premises here, aren't there, that that this is based upon. One being that there are two sides, and another that you would trust or not trust, and it might be more nuanced than that. That might not be how everyone sees it necessarily. I mean, for me, this isn't a debate about who I trust or don't trust. But if you're asking me, if this were like multiple choice exam, who do I trust among those people? I would, or give them marks out of 10. I could give you that from an emotional point of view, but it would only be an emotional. It would come from my prejudices and my echo chamber and my personality, but it wouldn't in any way be what people call scientific or absolute truth. It would just be a subjective opinion on all of those people, which I don't think counts so much. I mean, in my life that's important, but I don't think that should matter to anyone else particularly.
I'm going to echo a little bit of what Carl says, because what you presented there is people in government and organisations such as WHO and CDC, for example. Advisors like Fauci, you've got the guy who's in this medical organisation, Daszak, whose name, like I said, eerily crops up multiple times. But also then you've got these maybe potentially rather sensationalist medical personnel who've kind of espoused these claims of other treatments. But I think also there's a third group. If you're saying who do we trust, and it would be the medical professionals in hospitals, emergency services, in places of care and caregiving. They would be the ones I trust. Research organizations, government bodies, and so on and so forth probably have done all sorts of business under the table or behind closed doors that no one's really privy to. And without any information, it's without full disclosure. I think you can be skeptical about what the sort of level of trust is with those people. So certainly the groups you presented so far, A and X, I think I would hold them equally in the same regard. But if you said who would I trust, then I would go for the third alternative, which is medical professionals on the ground.
But do not medical professionals, as we've seen, have to act under the orders of their advisors, the official mainstream? So they don't really have a choice, do they? They have to follow the guidelines like basically everybody else did.
Well, again, I'm sure it's the same in Portugal. You've got like a general medical council that will be abreast of all of the research and best practices, and that would be disseminated out to all the personnel. So I think the reality is, if you're going to put your blind faith in someone, maybe it's the people that are on the ground, experienced and dealing with first-hand issues of care and maybe sort of diagnosis and that kind of thing.
Well, that's a very good point, because for both sides of the argument here, in the early days of that pandemic, they were desperate to try and help people, as a doctor would do. But
it's the Hippocratic Oath as well. I mean, they've sworn an oath to treat regardless. That's their professionalism.
Yeah.
And I think I don't see government ministers or funded bodies taking such an oath. Care above all else. So like I said, I'm sceptical when it comes to both of the groups who presented. Naturally, I think quite healthy skepticism. But if I'm going to kind of like lay my hat down in someone's ring, it would be definitely the third group that I think will need to be discussed as well.
Matty, any points you'd like to make there?
Well, one is that in the beginning of the outbreak of the pandemic, nobody had a rule book or something to hold on. It was new for everyone in the widest sense of the word. And if you ask me who I trust, the answer is easy. Nobody, just me.
That's a very good point. I mean, I think that's what a lot of people in the end came to, because they were so confused and disorientated about it. They thought, well, okay, who can I trust? Me. So we get a lot of different variety in what we believe, what we do, how we treat it, this, that, and the other. But it's a fact that you weren't allowed to get on a plane without vaccination. You weren't allowed at one time to go into an enclosed space without a mask. So you were being told what to do, whether you liked it or not. You didn't really have the choice. Otherwise, you just don't do those things, do you? Now we've got some comments come here, and I'd just like to put a couple on. A lot of them are greetings, which I'm not going to kind of do because they're not relevant. 3 peas in a pod obviously loves Dr. John Campbell. I think Pete's in on this one. Inmates at Arkansas jail have filed lawsuit against the facility and his doctor after they said they were unknowingly prescribed ivermectin to treat COVID-19 as a form of medical experimentation, which is a fair comment. Sorry, I'm trying to do everything at once. So we did exactly the same in the beginning, trusted what various mainstream government sources were telling us. I thought they were looking after our best interest. Well, isn't that what we all, we're hoping would happen? So a Japanese company tried to get ivermectin tested, but Merck didn't want it as it cost more to test if they could sell it than they could sell it for. Well, the thing is, right, and I'm going to be fair, I'm going to give some balance to this, right? All the medical tests that the medical mainstream performed said that they could not get the same results that the alternative group published. And I believe it was down to a lot of misinformation, poor reporting within a lot of their big trials, which weren't registered properly. And then they got accused of obviously misleading information, etc. Some more comments coming in. Nurse Campbell has been largely discredited during the Black Death they used to prescribe sucking babies out with chickens' anus. But yeah, okay, Pete. obviously Pete is a strong advocate of the vaccine, shall we say. A lot of money was wasted in tackling COVID, for example. The UK spending 19 billion on a trade
Track and trace.
Yeah, sorry, that didn't work. Whilst Ireland spent 850,000 on an effective system. It's one of two. There's another one. Also offered to the UK. To give you an idea, if you count in 1 million now, it would take you until Wednesday. To count 1 billion, it would take 37 years. Eric J's in the house. NIH admitted to US taxpayers funded gain of function research. Well, there's another contentious thing. Although they've admitted gain of function research, the sticking point was it everything to do with human coronaviruses? And even to this moment, that is being debated. For me, the incredible thing is, and I didn't know this, that the Americans were funding that sort of research in China, which to them is a hostile nation. It's regarded as being a hostile nation. Why wouldn't they do it themselves within their own confines without farming it out? Could it be it was cheaper? Could it be it was less risky? Who knows? I don't know, but I was quite stunned by that. I really do. I do really think that. Another comment come through. Some countries didn't take part in the elitist pantomime like Belarus. No masks, lockdowns, and they come out better than anyone with less deaths, injuries, and damage to their economies. God, we have quite a few big comments here. Right, another one. How can we trust all the media when themselves aren't impartial to any news they report on? One can undermine opinions when we don't get the full spectrum of news itself. But it's true. Everybody has their own spin, and the information that you get is liable to be tainted by that spin. And I'm completely aware of that. Andy, come on in, please.
Okay, just going on from that, I know there's probably lots of comments coming in. My own first feeling on this kind of the rollout of actions taken by, and again, my milestone is UK government. That's where I was in the first kind of signs of this pandemic. Is the first kind of news waves that were being kind of mooted about COVID was in like October, November of 2019, if I remember rightly. I kind of tabled the question in January to my colleagues. What was their plan should this get progressively worse? And my colleague said, we're going to go with UK government guidelines. And it's okay, fair enough. But already there was enough information kind of starting to become available in December, January about COVID for more of the world to kind of pay attention, I believe. And I think the UK government was slow on the uptake. They were indecisive in their actions, and the subsequent lockdown and mask wearing was too little, too late. I think that the point of lockdown would have been good in maybe December or January, but when they eventually did start the first lockdown process, there was no point. As far as the horse was already out of the stable, you might as well have just carried on regardless. As for PPE and mask wearing, it's not wearing the mask that prevents you catching stuff. It's the prevention of spreading. There's the reality of wearing a mask. But okay, it's not a perfect filter. But if you're coughing and spluttering and sneezing, and wearing a mask, it doesn't transmit as far as a radius, or it doesn't land on surfaces. So I was an advocate for wearing a mask. I think obviously also the general public should have been rightly sort of informed and drummed into them that hand washing is a thing. Hygiene, basic hygiene should be taken more seriously. And to echo that, when obviously my wife was first kind of talking to me about this, she was very, very concerned about the contamination rates, the daily rates of infections, and all this information that was available, she was rightly concerned. And I think if you ask anyone in a hospital environment about COVID, then I think the universal truth would be it was a very, very stressful, very fraught time for all in that service.
But we still don't know where it come from.
Well, this would be my set of questions: is it likely to have commenced or broken out from this laboratory in Wuhan? Do you think the safety procedures were lack, and that mean the live specimens ended up in a food market in Wuhan? Do you think it was naturally occurring in a live food market in Wuhan? Do you think someone left the laboratory with a human case and spread it around Wuhan? What do you think that most likely scenario is? Because there's no smoke without fire, right? It started in Wuhan. This whole kind of outbreak, right?
Well, to coin a man cave expression, I don't think anyone really cares. Really, I mean, we can make ourselves care now, can't we? Because we're having a debate.
Well, you say no one cares.
Generally speaking, we've moved on. We're bothered about whether Gary Lineker presents Match of the Day now.
Well, I mean, I don't care about
deaths in the UK that far outweigh the problems of the pandemic. No one's talking about it. No one cares about this anymore.
I don't really care what a football pundit tweets on his private Twitter account. What I would like to know is,
but most people seem to,
or
we're led to believe that.
Well, I don't care. The reality is, I still want answers to some very basic questions. Where did it originate? And will China ever fess up and let that information be known? Does it make them culpable to all those deaths? And why was it? I'm sure they knew about it well before the rest of the world knew about it. Why wasn't more information shared more willingly if there was a potential pandemic on the table? So there's a few basic questions that I would still like the answers for.
What would you do, Andy, if you found out?
Well, it's just for my information. It's just like we actually know some facts. This day and age, as Garvo was saying, like this misinformation thing is what I think sometimes we really need is some raw home truths, regardless of whatever. I just think we need to know the knowledge. We need to learn for next time.
What? There's going to be what? No.
You've heard of this phrase, history repeating, right?
Well, there was a little bit of a giveaway in what you were reading from one of those earlier correspondence, Garbo, wasn't there? We've been planning this for a long time.
Yeah, exactly.
Getting ready for it or whatever they were doing. Yeah.
But like you'd be foolish to think, but just because we had one Titanic, that another ship is not going to sink. Ships sink all the time. But the thing is, you learn from the past. That's the point of history, is you learn from it and you try and cover your backside better for the next time. So like it's not like we're not going to say ships won't sink again or there will never be another pandemic. It's
Andy, regarding Titanic, was there ever an unsinkable ship after the Titanic?
Well, I mean, that's tangential to my point.
Don't ask me to do that.
But it's no, that's a whole other discussion. But the
it's
point
a great metaphor. It is a good metaphor.
The point is, it's like
again.
The point is like there will be another pandemic. Like surely, if we know where we went wrong this time round, because I'm sure there was lots of errors made, then we're better armed and better prepared for the next time. You know,
there's another premise in here, though. Thank Andy. I'm not disagreeing with you. I'm not meaning to debate or deny anything you're saying. It's interesting what you're saying. What's interesting to me is where is the premise there that our position about it doesn't change. So, you know, in many ways, it could be seen as quite foolish for some people here if they let it happen to themselves again. And what's interesting to me about this is how it's you know, it seems to be out there, doesn't it? That what's going on. We view it as a conscious being of this phenomenon that happened to us in the last 3 years, and that's amazing. It's those 2 weeks to flatten the curve are finally over in 3 years' time, apparently. Thanks, Eric J, for that. But really, this is another one of those proxy things, isn't it? Like the pandemic, Ukraine. What's going on with this is what we're finding out about ourselves individually, and whatever in a way, it's irrelevant what the data is. What's important is what I think Garvo is getting at with the point of this debate, or live stream event, is what's triggered in the person and why. And that to me is has been really fascinating about this, because we could all be debating this and getting and falling out or falling in whatever bit of the echo chamber you're in till kingdom come. But the liberation from it all, I think, lies in seeing what's being triggered by these external events in yourself. So for me, whenever I talk about this, I get a knotty stomach, which to me is like a somatic clue to something I need to take care of personally about myself, which has brought me to the point of having my opinions such as I do about these people. So when I see Fauci now, I feel a bit sick. Now, I don't even know the guy, but I know that repeated exposure to him and the echo chambers I put myself in have caused that. And the intelligent question to me is, why is that? I don't even know Tony Fauci. I'm never likely to meet him. I don't know if he exists. I don't know if the virus exists. I don't know so much of what I'm supposed to be talking about here. But I do know how I feel about it inside. And that is the most important thing. And I don't mean how I feel in a sense of, am I angry? The intelligent question is, why am I angry about it? And I don't know if that's what you were getting at, Gary, with your analysis, or what this might bring to us. Because it's if you make it about Gary Lineker or Ukraine or Silicon Valley Bank or Prince Harry, Prince Andrew, all of these things are just proxies for our own possible healing or transformation, because no one's going to give a shit about any of these things.
Well, saying that, look what Eric just said. He kind of hit the nail on the head there.
Exactly.
Now, okay, let me just try and.
I was just going to add one more part to this. I think what's become quite draining and wearisome for this entire subject, it could be any subject. The point I guess what I'm trying to get to is, it's the amount of conflicting positions being rammed at you from all and sundry social media or mainstream media outputs. There was no cohesive, fact-based stratagem. It was all like, oh, maybe this could work, maybe that could work, maybe you shouldn't wear a mask, maybe we should wear a mask, maybe it gives you two tails or will sprout hair on your palms. But the point is, it was so exhausting because there was nothing else mattered apart from COVID. It was coming at you from every direction. But it was, you've got all these different outlets spouting all sorts of information, which I don't think was appropriate or necessary. I think what was, like I said, what I think we really need as a race of beings is some no-nonsense fact. That's what I think we're lacking in this day and age. I think that's why maybe Carl, you get that knotty stomach, is because there's lots. I
don't think any amount of facts will sort that out. I think my own.
Matty, I think Matty wants to comment.
Sorry,
okay.
Matty.
Well, my point of view is that the whole COVID thing, if nothing else, did give to some people some kind of maturity, like growing out of the fairy tale that there are entities that have the best interest of us in mind. And Andy, what you just said about information that's coming at us, it's coming at us 24/7 a day. If it's not COVID, it's something else. And what everybody should have learned from this, especially, is don't believe something you see on a screen just because it's on the screen, or just because there is a title of the person on the screen under it that suggests that you can trust this person. Make your own investigations. See if there are facts. Verify with your own brain, and don't be a lamb and follow the herd.
Which brings me perfectly onto the next and the last bit of the presentation, right? And let me see if I can get you on this one. Let me see if I can replicate on this one. I'm going to do it. It's risky, but I'm going to do it. I'm going to say the word, the ivermectin word, right?
Oh, I thought it was going to be Donald Trump.
We've said it now, yeah. Let's go back to the first group, the alternative group, and they were broadly run out of town for their support of ivermectin. Yeah, there was no test that could recreate the data that they were going to be sort of putting forward. And then you look, okay, I want to be objective. Who comes up with this information? Who's doing the testing? Who verifies this? And who's funding them and what's part of them? So let's just take a little trip down this. I'll do my disclaimer first because I have to. Right? This presentation is for the purposes of debate and open conversation. It no way encourages or recommends the use of any alternative medicines or medical procedures that are not approved or officially certified as treatments against COVID-19 or SARS.
Well,
So
well
very
said,
brief-
well said, Andy, Gary. Because for a useless thing, you should go to all of that malarkey just to protect everybody from a useless medication. Thank
Well,
you.
okay, let ivermectin, the horse medicine, yeah, the choice of tin hat wearing individuals. Let me put
You
them on.
probably want to put us in the back.
Yeah, sorry, it's my. I'm going to
backstage.
just remove you guys so we go full screen just a second and get back to my initial full screen. So ivermectin, it was discovered in 1975. It was initially used as a veterinary medicine to prevent heartworm and whatever, I can't even pronounce that, head lice, scabies, and river blindness, which is obviously also caused by worm infestations. So just a bit of background there. But roundly dismissed by most everybody in the mainstream as being, snake oil or whatever. Now, just randomly, I tried to find one of the universities or medical institutions that did the tests to just, to make that sort of proof. And we come up with these guys. Duke University, a very respected top 10 university. So a team of scientists affiliated with Duke University found that ivermectin does not meaningfully improve the recovery of people with mild to moderate COVID. These findings do not support the use of ivermectin in patients with mild to moderate COVID, they concluded. A previous study found that ivermectin does not lower the risk of hospitalization from COVID, and the FDA has warned people against taking the tablets for anything other than approved use. So that's fairly salient, isn't it? And they're just another little thing to confirm that Duke were, doing some research on the ivermectin product. Now, then me being me, I say, well, okay, everybody's got a spin, like we say, they've got their own viewpoint. Who's doing the funding? Who's doing the funding on all this? Let's have a look at that. So 130 million investment from Deerfield, which are an investment company, and that always gives me a bit of a chill when I hear that to do with medicine. But as we know, money is medicine. So there's just a little bit of a sort of more on that one. Deerfield and Duke. So the question comes then, who is Deerfield and Duke? Who are Deerfield? But I thought, well, who else is involved in the mix? Now, just cast your memories back for a while, because he's going to appear again. Now, I don't say this was the ivermectin trials, but he's done work for them and they've connected together. The Duke researchers, this is not COVID, this is something else, but it's relevant. Duke researchers then turned the isolated antibody up to researchers at the University of North Carolina because they're working with animal coronaviruses. An antibody was tested on mice and it was discovered that not only did it block infections, but also minimize symptoms once infections occurred. When given before the mice were infected, the antibody provided protection against developing SARS-CoV-19, the Delta variant, and other variants of COVID-19, and many animal coronaviruses. A quote, the findings provide a template for the rational design of the universal vaccine strategies that variant-proof and give broad protection from known emerging viruses, said Dr. Ralph Barrick. Do you remember who he is? Do you remember him from the Wuhan story? So he's looking there in the background in this one. You can't see from because there's a comment there, but he said Barrick, the fellow researchers at University of North Carolina, worked on developing the Moderna COVID-19 vaccine, as well as the antiviral medication remdesivir, which is used to treat COVID-19. So you got a guy there who was involved with the creation of the virus. The scandal when it escaped, possibly, and now he's found the cure, and he's also got a bit of a thing going there with remdesivir, which is one of the most widely used drugs in that treatment. So back to Deerfield. This is where it starts to get really, really bizarre, right? Deerfield belong to Oncorus. They have a link with Oncorus, and to not drag things out too much, Oncorus actually announced a research with Daewoong, which is a massive Korean drugs company. What have Daewoong been sort of looking at? Yeah. They've been looking at approval for a phase 1 COVID trial for an anti-parasite drug. Gets more and more bizarre as it goes along. Here's some of the links for that. Yeah, nicotinamide, a promising treatment for COVID-19, which we know is an antiparasitic drug. So let's have a quick look at what that actually they say about that. The leading causes of mortality in COVID-19 patients are exaggerated immune response, as well as the secondary bacterial infections and developments of ARDS, which is acute respiratory disorders, isn't it? Nicotinamide can function both as an antibacteriostatic agent as well as an immunomodulator, thus has the unique advantages over other agents currently being tested in the COVID-19 arena. What is it? What is it? What is this strange and meaningful substance? Nicotinamide, sold under the brand name Nicoliside, amongst others, is, and I can never say this word, an anthelmintic medication used to treat tapeworm. It's a horse. No, it's not a horse, but it's a dewormer. A dewormer, right? So the story has gone very much back on itself. And if I come back to my camera, it's kind of strange because that substance they're looking at there is now in phase 3 study, and has heralded good results. A dewormer, an antiparasitic, which is where the whole story started. So let's watch that space and see if that actually appears in the news. Now, how do you feel?
I'm less triggered now.
Anybody else?
It's interesting that these anti-parasitic medications seem to have more than that application. It's kind of like a happy byproduct, possibly that, but there is ivermectin prescribed for humans, different from animal ivermectin. I did do some light reading on this earlier, and again, the advice seems to be, generally speaking, don't take it other than as prescribed. So, I mean, if you have tapeworms, probably some sort of anti-parasitic medication is your kind of ballpark. I like anything, if there was lots of testing done and it proved to be somewhat beneficial, so be it. But I think I haven't had any solid truth evidence to say yes, this is actually viable, or this is something to have. And again, this is where I go back to my statement earlier. If I'm going to trust anyone, I'm going to trust medical professionals on the ground in the patient care.
So that's a scenario that could happen, right, Andy? You could go, let's say, God forbid, you got a COVID positive test, and you went to the hospital and they said, you know what? Remember this drug? It was funny because like 3 years ago, everyone was saying it's rubbish, but now we've actually found out it's the right thing to do. We're going to give you some. You'd take it then?
Well, if it's from medical professionals that have had this kind of direction from their medical councils and the medical professionals, yeah, I would have to go with the trust in them, not politics, not pharma, not all these other people, but actual proper medical industry profession. So
not chicken anus. We've come a long way since.
But the point is, like I said, this goes back to my first point. If I'm going to put my faith in someone, it's going to be people I know who work every day in, day out on the ground, coal face, if you like, on the ground, dealing with patient care. These people are constantly refresher training. They're constantly being given the latest information, procedures, and updates. My wife speaks to all and sundry doctors, and she said to me, ivermectin in certain doses is toxic to humans. So it wouldn't suggest that as without proper information, wouldn't suggest that as any sort of remedy. because of its toxicity. So I would, like I said, I would get information from people in the know, on the coalface, if you like, would be my source. But
you could argue, Andy. You could argue. I've got to stop you there, right? That any medication is toxic within a certain dose. Paracetamol, if you take a large dose of it, is toxic, and that's freely available. You can buy that anywhere. And I think what happened here, I'm not defending ivermectin because I have no conclusive proof that it works. Okay, but what people were doing were taking horse-sized doses, which probably would cause them quite a lot of damage. But when you don't have that information there, people will do silly things.
Right, of course.
But who was? I mean, this is the thing, isn't it? All of this is so abstracted. Like, who do we know people? All of this debate is structured out there for a particular reason, isn't it? We're not working and living with people whose opinions and behavior we can evaluate and trust. This whole thing, it has a kind of eerie and uncomfortable ring to it, because somebody, like a computer salesman, is involved in it. Dr. Fauci, who's previously been discredited for things, is involved in it. All of these people are just like hustlers, aren't they, coming into this? And we're taking bits of information from them or not because we don't like them, and it's all really very meaningless. There's nothing that substantial about it except to justify either support or our prejudices, our positive and negative associations with these people, and our preformed opinions that we bring to it.
Very good point. Very good point. I'm just going through a few more comments. I can't read them, and
you can definitely take the lads out of the man cave, but you can't take the man cave out of the lads, right?
Well, everybody's got their own opinion. You don't have to agree with it. But what I'm trying to sort of put to the people here is that basically, and this is what I feel, is that nobody really knew, and I don't think they still do know.
Exactly, of course, and nobody.
Can I give you an analogy?
Nobody ever will they? Like when they get on the boat, they don't know if it's going to sink or not.
I give you an analogy, right? Imagine that you're in a room, yeah, and there's a fire exit on the right and a fire exit on the other side, yeah, and suddenly your fire alarms go off, and obviously people are going to go different ways. Now, just imagine if the fire exits were actually a corridor that went back to the opposite exit on the other side. So everybody heads down, right, out to the fire exit. They meet each other in the middle. Now, what's going to happen? You're either going to tell the people they're going the wrong way. You're going to have a big fight until somebody gets past each other so they can get out the other end. But in the end, you come back to the same room as where you were. And you're totally thinking, well, what next? Until somebody actually thinks, well, why don't I go the way that I came in through the entry? And sooner or later, a head will pop out and we'll have a look. And look around, the actual possibility that there is something else. And that's how I feel. That's how I feel in the COVID debate, because we've come back to exactly where we were before. There's no guarantee that we're going to, it's not going to happen again. We seem to be on a track of never-ending injections and boosters and this, that, and the other. So what's changed? It's still there. It could mutate into a highly more virulent form. We don't know. So we've got no answers now. We're no further down that track than we used to be.
Gary, you are getting in some dangerous territory here, getting in the way of shareholder dividends. Be careful.
For me, and this is the personal point of view, the more things and the more weapons we have against it, the far better chance we have of losing people, and the damage will be restricted. Also, looked after our health, our diet, and what we do in life, because without those, your immune system is not going to be able to cope, whatever.
I agree, but if you're talking about going into battle with a virus in any theatre of conflict, the better the intel, the better strategy you can have. So the more knowledge you have, the more information or fact you have, then the better you can handle any situation. This is why I said, I think what really is seriously lacking in this whole last 3 years is any real credible constant of source of information. It wasn't governments, it wasn't prime ministers or presidents, it wasn't necessarily the people that you would look at like the WHO or CDC, and it's certainly not some of these specialists that are on YouTube with various kind of outlets to say, oh, maybe you should neck horseworming pills. What I'm saying is we need a constant, a solid source that a lot of people could agree on.
It sounds like the religious quest that, like we want an absolute. authority.
No. Religion's a belief system. I'm talking about facts and knowledge.
That's a dangerous word to use, Andy. Facts.
No, I'm saying faith is one thing. Facts and science and knowledge, something that's empirical, is different.
Where are those things now? Then how did they get hidden, or why were they absent, or did we not get there? Where are those facts?
I mean, you remember our former Prime Minister Johnson going, "Go to work, stay at home. Go to work, but stay at home. And if you can't stay at home, go to work. And if you can't work, stay at home." But that was the kind of message I got from 2020, and that really just underlines it. Complete blind leading the blind.
Where are the facts going to come from then, if that's the case?
I mean, I ask you the same question. Where are they coming from?
Well, that's what I'm saying. I'm saying don't hold your breath. I'm saying, Garvo, check your brake cables and don't hold your breath for facts from anyone, because they're all like me. They're all subjective, and they all tell you what they want to tell you for their own benefit. That's what I do. Don't you all do that?
Well, that's very true. That's very true. David's come in, so I'd like to let him give a chance to say something.
Yeah. I just want to talk a little bit about. So I put a link in the Man Cave chat a long time ago, and what it was is, there's studies on ivermectin, right? There's been a lot of studies on ivermectin, and so this is an analysis of the studies. So that's. We all have priors. I think we're sort of talking about these prior beliefs, right? Or we have, our context we bring into a situation. It's based on our experience, our biology. All these different things can lead to sort of what we tend to believe when we go into discussions about things. And so that's what science tries to cope with. It's like, okay, we need to try to remove our prior beliefs and try to challenge what we believe, and then see if the evidence holds up. And so that's the whole point. That's why science is so successful, is it challenges our beliefs.
Science is not about beliefs. It's about a hypothesis and then prove it or disprove it. It's not about
that's
belief.
that's what is a hypothesis. Here's what I think is true. That's like a belief, right? This is what, and then now I'm going to challenge it. And so that's sort of why it's really successful, I think, is because it challenges your prior beliefs. And so anyway, this meta-analysis of all the different ivermectin studies, the concluded that and basically, you can't. It's really difficult to prove causality, like ivermectin did cure you of the disease. But what they can look at is a lot of data from people who take ivermectin, and then what is the outcome. So that's what they've done. They looked at all the data, and they did find that there was a correlation between positive outcomes and ivermectin, but only in certain parts of the world. No. It's not even close to vaccines. No. But so they found there's a correlation with positive outcomes and ivermectin, but only in certain parts of the world. Okay, and guess what parts of the world
that don't have vaccines?
No, parts of the world that have a lot of worms, parasitic worms.
Okay.
Well, that was actually muted
India,
a long time ago.
Brazil, like right along the equator, right, where parasitic worms are like a major problem. And so,
of course,
it's really easy to look at that data. If you look at one individual study, okay, well, here we go. It must work. And then it's like, no, it's not that simple. You have to look at a lot of different studies. The more studies you look at, you're never going to be 100%. I know for sure 100% this is what the truth is, but you're going to get closer to having an understanding of what you think is going on. And that's what we're trying to do here as human beings, right? We're trying to get to an understanding of what we think is going on.
What you need to not forget is, when you look at studies, also check who's paid for them.
Exactly.
Yeah, of course. But again, we look at one study and then, well, who paid for this? Oh, well, there must be a conspiracy. No. Maybe in this one study, there's something there's a problem here, or maybe not.
Really want to go into this?
Did the analysis of this ivermectin? Well, one of the conclusions was people had less parasitic worms after. after the testing.
It's very possible.
Yeah.
But
That was a positive,
That's
right?
a result, isn't it?
That's a less parasitic worms anyway.
it just seems strange that that after all this, the story looped back to a medicine they're trying to develop, which indeed is an anti-parasitic. So maybe these guys, in the first instance, maybe they did discover something, like Dave said, some sort of correlation somewhere. And as I highlighted in the early part of the pandemic, right, we had no treatments. We people were dying, dropping like flies. So as a doctor, you'd want to do something to try and save them, wouldn't you? And maybe if that works for the next, they're
Right.
obviously convinced that there's something there that
Is that
works.
true? There were people dropping like flies.
Yes.
So we're told. So we're told.
Yeah,
Right.
it
Just
exploded,
ask you, I
especially
don't
with
know,
old
folks.
people, especially with
Right.
old people or anyone who was vulnerable for other reasons. Early on, it was really clear that children were not affected for the most
Yeah.
part, and old people were definitely vulnerable. And so
But
that's
like
why
with
it's
any
interesting.
flu season, it's the same comorbidities in elderly people. But there was a
No,
marked,
yeah,
there was a marked difference. Was there? People were dropping like flies because
There was a
Yes.
market.
dropping like flies, to me is memories of my media propaganda conditioning of those
yeah.
in China that keeled over. Like two videos that got played over and over again, and the Italian mortuaries of bodies piling up, and that was enough, wasn't it, for me to think, oh my god, people are dropping like flies. Which is not a very scientific
Right.
term, is it? If you're going to be
No.
scientific about it, you would look at the numbers. You wouldn't say dropping like flies. You would compare, are they dropping like flies more than they normally do at a given time? But okay,
Yep.
they were dropping like flies, were they, at the beginning?
Well, so if you were somebody, like to Andrew's point earlier, if you were somebody who was working in a nursing home where COVID somehow got into a nursing home, it must have seemed like they were dropping like flies in that setting, yes.
Yeah,
Because it was
because
just
in a nursing
extremely
home, the people are
contagious.
really healthy and have a strong immune system in nursing homes.
Well, the
But
reality is that my wife, her experience in Lisbon is they brought in freezer units to create temporary mortuaries for the volumes of deaths that were increased over average. So
yeah, and they were just burning. They
Yeah,
were
well,
burning
they
the bodies
had
in
to-
India.
Were they
because
used?
obviously they had to accommodate dead people somewhere, and there isn't the capacity to have like an increased burial rate, especially when there's people in lockdown. So
People are saying that now, though, aren't they, about excess deaths? See, what's interesting to me about that time, to use a scientific term, correlation is not causation. They hired in
Right.
freezers for bodies. Did they use them? Just because they hired them doesn't mean lots of extra people died. The fact that they hired them only means that they hired them. If they were full of dead bodies, that would have said something. But the mere hiring of a fridge, or
I did ask
big...
Margarita to give her opinion on this point if it came up, and she's refused for her own reasons. But I think partially, I remember at the time she was very, very concerned for the state of the planet, for the health of the people. She works in the industry, so, and my cousin Michelle again works as a casualty nurse. Her experiences parallels Margarita's. So I mean, I can.
And in their experience, anecdotally, they were seeing people dropping like flies.
But she works in the NHS in the UK, so they took similar measures to have expanded temporary mortuary places because the hospitals weren't equipped for
I get that. I do get that. I mean, and they built those Nightingale hospitals, didn't they, for the thousands of people that were going to need to be triaged and treated, and they were never used, as far as I can tell, or not for their intended purpose anyway. So, and I can only speak of my own experience. I hear this, that people are dropping like flies, but in my own experience, my stepfather died during the pandemic time, and I think he was killed by lockdown policy, not by COVID.
Right.
Yeah.
My sister's father-in-law also died during COVID, and again, quite sad and alone that even his funeral was like only attended by 2 people or something ridiculous. So That it was a thing for sure. And I think I agree. Policy, it was probably equally responsible. The lockdowns, I still believe, were too little, too late, and therefore pointless. Personally speaking, because it still went around the population.
Well, we have some in the U.S. Because states would sort of go their own way. We have a little bit of evidence around, what happened, and somebody mentioned Belarus. What happens to places that locked down versus places that didn't lock down, and the numbers don't seem to be all that different. In the U.S., we have the Democratic states and the Republican states. It's largely Republican states who didn't lock down, didn't close schools, and my personal belief is they were correct not to lock down and correct not to close the schools, and the statistics sort of back that up in the short term, but we won't know for sure, until years from now when we see, the effect on children, for instance, that it could be quite dramatic. We won't know that for a while.
You mean
But
psychologically?
yes, and they're because they don't learn the same at home as they do at
No.
school.
No question.
So they missed a year or more of school, and it's going to matter. In the U.S. though, obviously the Democratic states, they were all careful. Let's lock it down. Let's get the masks, and everybody get vaccinated and all this, and they're right, to be concerned, and especially it seems like the data really supports that vaccination, at least the first shot and the first booster shot, turned out to be pretty good at this point. I think there's probably, my understanding is there's no point in an additional booster at this point, but data seem to indicate that getting vaccinated was a good thing to do, and Democrats did that. So they got part of it right, and then the other part wrong. They got the lockdowns wrong. They got the vaccination right. And then in the Republican states, they got the lockdown right. Don't lock down, but they got the vaccination part wrong. And so, everybody, and part of it is just it becomes a political battle for people. And
Exactly.
if you're
A proxy, like I said.
Well, like I said, I think that the UK was slow to act, and hence the UK lockdown was pointless because we had in Europe the highest cases, the highest deaths daily. I believe that was UK was number one for that for a big chunk of the first lockdown in 2020, I believe. There was like world data. There's a website with all the stats like posted onto it, and it was like always in Europe. It was like UK was at the top spot. But again, they kind of relate to lockdown, and then decided to lock down after it was already out and around circulating. So and then they had this bubble rule, which I didn't understand really fully.
And then they come out and just print money.
Right.
It's just like, here, well, let's just give everybody money.
I never got that. I have to say that was a shame. Yeah. I would have liked some free money. That would have been good.
And
Well, sorry,
it's just total corruption. People were stealing the unemployment insurance. There's so many scams around unemployment insurance in the U.S. Just loans to companies that they'll never have to pay back.
Right.
It's a, like you were saying earlier, Andrew, it's like we need to think about this stuff because we should not let our government, or we need to protest our government if they start doing this again. Like, here's another pandemic, we're going to start printing money. No, that doesn't work. You guys are idiots.
Yeah, and think twice about the kind of data of like kind of diagnosis of things is the information needs to be shared globally on demand virtually. There needs to be kind of finger on the pulse here, which I think we could probably observe. We were sadly
that was one of the things that really didn't happen. There was no global sort of unity in a particular type of policy. It was, even in parts of America, it's completely different. We
did not get. You had cities had one concept of what needed to happen, and then you just leave that city, and it's a whole other planet, basically.
Yeah.
In the US,
that's right, though, isn't it?
There's MAGA hats everywhere.
What do you want, Gary? The West to make to.
I'm just saying that
let's have one world government policy on this, and we'll have one world army to back it up.
I'm not saying that. You kind of misquoted me out there, really. But if you don't have a policy that's of one direction, then it's not. What's the point of having a policy?
But
Because
that's
it's
life,
just not
isn't
going
it?
to
I
work.
mean, that's natural and real. There's no,
Yeah.
I think we have this crazy idea of the globalized world of whatever it is, 6 or 7 billion people. You can't have a one world policy, can you? That's just the
No,
strange
because
psychologically twisted belief of some individuals.
well, if it's the wrong policy, then the whole world's screwed. Is the problem?
Boom! Yes, yes.
So that's why you kind of like people do different
it,
things. Like, is that working better or is this working better? And then you sort of
Yeah.
but
pick the
it's not
route
like
that's working better.
I wasn't going to say impose a policy. What I was going to say is everyone needs access to the same information instantly, like on demand, real time.
We've got the internet
Because-
for that, haven't we? Oh
Yeah,
yeah,
but
no, that doesn't work.
Clearly, yes, we have the technology. We don't have the procedure.
Andy, one element to your statement: unbiased information, not manipulated by anyone.
Just factual, empirical data would be fine, I'm sure.
But who produces the data? Who
AI.
makes it factual?
Chat GPT will sort that out for us.
No, I'm talking about professional diagnosis, professional reporting that is
Right.
been validated and then is
Professional,
available
paid by whom?
entire global
Exactly.
medical
Right.
profession.
Not helping.
I mean,
That is in our world fairly unobtainable because everybody's got funding from somebody else or influence from somebody else. Nobody's truly independent, and because they never get to be heard because they don't get funded, they don't get to the screen.
Well,
And
they're not honest, right? They're not honest. This is the
Well,
great big
that's-
problem, isn't it? They're not honest about it. I gave
Well-
you disclosure and transparency. I do what feeds my family. I try to be ethical, but ultimately I will do the thing that helps me survive. And that might not look very elegant sometimes.
finally somebody said it, right?
Honest.
Finally somebody said is that I do in the end what I think is best. And really,
And I'm responsible for this bit, and I
Yeah.
take responsibility and live or die by that. I will, won't I? I might
As long-
overdose
as
on
long-
ivermectin or vaccinations or whatever, but it will be me that makes that decision. And
absolutely, Cole, I could not agree with you more. Right, in your own sphere, you do what you think is best, and other people have to respect that because it's your
They don't,
family,
they
it's your life.
that's like
Oh, they don't
factory.
always respect
They
that.
won't. They really.
Well, you
My
should learn
personal
to.
experience tells me they don't, and I'm
Yes,
good
they
with
do.
that.
Well,
I'm fine with that. I have to be fine with that. Did you like Neil Oliver, don't you?
I do,
I
yes.
found out tonight from a podcast of his that 300 years ago, people thought that the world began 6,000 years ago. That's just
Right.
300 years ago. The world,
So
if they thought about it at all, they thought the world began because a clergyman told them at 6 o'clock on the 22nd of October or something, the world began 6,000 years ago. And people went about
Yeah.
their lives either thinking or not thinking that, but that was the received wisdom of the time. And that's only bloody 300 years ago.
But this goes back to my original argument, right? And it's a big one.
But it
between
really
you and I.
didn't matter, right? What does
Hang
that
on, Dave.
information?
Hang on, Dave.
How does
Hang on,
that
Dave.
affect them?
Dave, can I just please? This goes back to yours and my long-running argument, right? That information is passed to you through somebody else normally, right? You read it, or somebody teaches you something, or you see it on the television or internet or whatever, and then it's your own experience. Yeah, your own experience. And really, neither can you trust 100% because when you're taught by somebody or you read something, it's always gone through somebody else's perception. And
Unless
they
it
load
comes
it through
direct
that
from God. Mike, the stuff I get direct from God, I'm good with.
Well, that's like you're obviously the favoured one, aren't you? But even
No,
your
I'm
own
not saying that. I'm not saying that.
even your own experience can be faulty. For example, if you get bit by a dog, you become scared of dogs. You have the prejudice
Yeah.
against the dog. Not all dogs bite, and most dogs are very lovely creatures, but you can't help it. So
I have that
Yeah.
with real estate
Let's
agents.
call it-
I don't trust them.
Yeah, psychologists call that a trapped prior. Like
Yeah.
if you're scared of dogs, you can have any number of wonderful dogs come up, and it won't matter. It won't change your opinion about dogs one bit. You can't. It's just psychologically you just can't move from that position. Some people are, and it's that's almost like a religious thing, right? It's like I believe this is true, or I know this is true. That it's you don't know why, you just do, right? It's just in you. And so But that's not how we should think about COVID. That's not how we should think about, governments and the way that they do things. So it's important that we not get stuck in our prior beliefs when we're
Yeah.
dealing with those
Yeah,
things.
absolutely, David, and then to look where those prior beliefs come from. I mean, that's really important work, isn't it? And you could look at that from a psychological or spiritual point of view. That's what I'm talking about. How all of this is a proxy for our own personal development, if you like, without wanting to sound too wanky or navel gazing. Ultimately, if you've got trapped priors, that could be PTSD, trauma, life experience. Yeah, it
Yep.
does sound like a painful condition, and I'm sure Pfizer have got a medication for trapped priors, and if not, they're already working on it and paying a team to come up with some really good results for it. Allegedly,
Yeah, there's some medication for that.
yeah, of course there is. But that's the real juice here, isn't it? Because as you are ultimately on your own, you have only your view of this to take care of, to deal with, and that's where your trapped priors are and all your prejudices and things. And whilst you could debate it outside as what they should have done and what he should have done, and he's a good guy, he's a bad guy, it all comes back within ultimately.
Yeah.
So, leading to the inevitable sort of conclusion to this little broadcast, how do we actually avoid that emotional reaction that we have when we hear somebody come with a different point of view? How do we short circuit that? And how do we get it to a more general viewpoint, and reach some sort of humanity on it, some settlement? Because the world is full of bile and poison as far as I can see it at the moment. And I don't want to be part of that, contingent.
Hey!
There you
One
go.
of the
There it
solutions,
is.
Come on, dare
one
I
of
hang
the
on?
solutions, gentlemen, make it great again. That's
Oh,
one,
yes.
that's one of the
Trump card.
solutions.
Trump card.
I've been meaning to wear this, but just to show. What
You're too
will
late.
you go forward?
It's gone.
I'm going to go last thoughts around the screen. So, let's have some practical advice from you men of wisdom, and how we can get past that problem, because it seems to me ever increasing. So,
Where are those guys of wisdom? Where are they?
yes, well, we'll start with Andy at the bottom and work round, shall we?
Well, that's charming.
None taken.
Start with Andrew's bottom. Okay, so
I was going to work round as well.
reach around my bottom. Okay, fine.
No, it's not man cave. Come on, let's leave it there.
Yeah, okay. It's I don't know enough about medical industry or pharma industry. So what I would do in my kind of, because it's out in my wheelhouse, what I would do is I would ask someone who I know who's in the kind of field, and I would go to. Fortunately, I've got Route One through my wife, but I would speak to her. She would speak to her colleague doctors and professionals, and she would have guidance from the medical councils and the registration of nurses and midwives. So all of this information comes down from them, and if it was dubious, like, oh yeah, just take some anti-parasitic medication, they wouldn't probably pass that around to their medical circles. I'll be honest with you. So, but I will go with the knowledge that I can get, which I can trust. It's from the shop floor, so to speak.
Okay, fair comment, David.
Yeah, so it's for me, everything's a bit of a mixed bag. I appreciate this idea that you want to trust professionals, and in particular you want to find professionals that you can trust. Because there's just because someone's a doctor doesn't mean that they're a good doctor.
Right, of course.
But the way that I approach these things is, or I try to, is you want to get really good at listening to what people are saying and evaluating, whether or not they're being truthful. And so that's a really, really important life skill. And part of that is knowing how to ask good questions. And so it's really important that when you especially because journalists, they're supposed to ask questions, right? And they're supposed to keep asking questions, and they're not supposed to be just telling you what to believe. But right now, a lot of what we read online, what we see on the news is an agenda. And it's not good questions.
Surely not.
So
I think Lee might have the answer to the question here.
He does. He has an answer.
I avoid him having an
Yeah.
emotional reaction by staying drunk.
We've noticed, Lee.
yeah.
Yeah. Matty.
Yeah, so I think just get
sorry,
good at
Dave.
listening, get good at asking questions, and you'll be okay.
Yeah, I think I quite like that myself. Matty, anything? How are you going to avoid getting wrapped up in the emotional sort of consequences of all this?
Well, being autistic helps.
Fair play, mate.
But seriously, like I said before, don't trust anybody and try to prove the facts that you get presented if they are actually facts and not smokescreen for something else. And try to use the gray matter between your ears if you have some. That's it.
Wise words. Carlos.
For me, it depends what you're here for. Okay, why are you here on this planet? I'm here to enjoy my life, and that means necessarily dealing with things that stop me enjoying my life. And that the things that stop me enjoying my life are is what your question's about, getting triggered. When I'm having an emotional reaction, I'm not enjoying my life anymore, and that is a gift. That is a gift to me, that I've got something lurking in my psyche that needs attention, needs healing, needs transformation. So I would say don't avoid it. But I do understand Lee's approach, and I've used it myself, and still do occasionally. I think it's valid. I think it's very powerful. Getting triggered. That's why it may have sounded like quite a put down about this topic, but really, ultimately, it's not about the topic, because we'll be moving on, won't we? Well, it will be something else soon that's triggering us, and all day long it will be something. And it's not the thing that triggers you. It's what is inside you that's been triggered, that is there for you in your life and in your personality. And if your life's about constantly being right about things, we have a perfect world for that at the moment. And that is the world I think you've talked about on the one hand. And that's there, isn't it? Social media is beautiful for that. If you want to spend your whole day being right about things, finding the right research to show you're right, triumphing and berating, bullying other people into your way of thinking and probably not succeeding, we have that world. But for me, it's about enjoying life, dealing with what is stopping me enjoying life. And when those emotional triggers come, greet them as a gift and think, why? When I'm thinking that person who triggered and upset me as an asshole, that is just information to me. And it's not about them, me calling them an asshole tells me more about me than my judgment about them. And that to me is the juice and the gift from this and every other thing that's going to come and trigger us in the future.
And that's, Carl, is why when you point at somebody, you have 3 fingers pointing at you.
Yes, sir. I'm pointing at you, Matty.
Well, my last thoughts, for what it's worth, is that if you think about actually what you can do in all this, from the basis of the very minimum you can do is like whatever's going to beat this infection that you get is going to be your own immune system, right? And if your own immune system is not working properly, then whether you have an injection or whether you don't have an injection, things are going to go wrong. So you can work on that part. You can have a good diet, fresh air, less stress, good vitamins. There's the basis for being okay, because ultimately your own system is the only thing that will beat it. As far as avoiding emotional triggers, right, you can come with things like you don't have to agree with me. That is if you're somebody's ranting and rate, you say, look, that's fine, you don't have to agree with me. I don't say that I'm right, but it's right for me. It might not be right for you. That's your own thing, right? And terms like I did it with you the other day, Andy. I said, I acknowledge what you say. You may have noticed that, right? Now,
you acknowledge me. I exist. Yay!
Yeah, I'm happy with that, and there was no malice or put down in it whatsoever. I didn't
No,
say.
I was being glib with my reply, but I hope you heard what I was saying.
Yeah. Well, that's it. Just listen, because you can learn a lot from people just by listening, even if they're ranting and raving and talking a load of rubbish in your own sort of spectrum. So learn something every day if you can. But like I agree with Matty, don't listen to one person. So, gentlemen, the time is now just gone past 10:30, believe it or not. So thank you for your participation, if I can say it.
Can you say that again?
Thank you for your participation.
Thank you.
I'm sorry about my awful reading skills, but I think I might be a bit dyslexic, and I've had to shunt between two pairs of glasses, so I apologise.
Notice it, mate. Didn't notice that.
And you know it's my phobia,
job.
reading out in public, so
You did a great job.
done the best I could.
Yeah.
I hope you've enjoyed the conversation. I know that I have, and I'll probably have a couple of red
Put it in
dots.
the comments.
So the red dots on my head, it's laser sights. So
Are we doing an afterthought offline or?
if you want to have a quick chat afterwards, we can do so. But as far as the broadcast is going, I think I'm going to end it and thank everybody for the comments. There has been loads of them, far more for me to keep pace with and read out. I've been trying. I know what your problems are now, Carl. There are absolutely oodles of them. So thank you everybody for your participation. Thank you for watching and giving me your time. And it's been an interesting little journey, really. So I hope you have a good rest of the week.
Are we meant to do this now?
No.
That's the man cave. That's the man cave.
We don't do that. This is a civilized joint.
Friday night. Save that for Friday night.
Sorry.
Where
Friday
belong.
night. Friday night.
Sorry.
Okay. Good. Have a good week, everybody.
Ciao, ciao.
Friday night.